We're going to discuss some blood disorders. This chart is just a larger view of what you're going to see on this slide here, at the top here. So keep that in mind. If you want to see that a little bit more clearly, you can just go back a slide to see that. So the blood disorders, we can talk about red blood cell disorders and white blood cell disorders. Let's start with the red blood cells. In red blood cell disorders, the two major types that we're going to see are anemia, which we've discussed in the last few videos, and there are different number of or different types of anemia, but then also polycythemia. This is when you have too many red blood cells. So you can have not enough red blood cells, you can have issues with your red blood cells that will result in anemia, but then also you can have too many red blood cells, such as right here, polycythemia. White blood cells or leukocytes. So when it comes to white blood cells, the most common disorder that we may have heard about is leukemia. There are many types of leukemia, but the two major types that we're going to discuss, the two major categories, are lymphoid and myeloid. The major difference here, lymphoid, as the name suggests, occurs in the lymph tissue. So in the lymph cells and in the lymph fluid, in the lymph nodes, all throughout that part of the body. Whereas the myeloid cells are going to be those in the bloodstream. So a little bit different, and can have major differences in how they're treated and how they spread. Another white blood cell disorder that you may be familiar with is mononucleosis, which is also known as mono. And this is caused by the Epstein-Barr virus. Some additional blood disorders that we can discuss have to do with hemostasis, which we discussed at the very beginning. Hemo, again, is blood. And then stasis, similar to homeostasis, is balance, right? So how does our body balance the different components of our blood? We can have challenges with our thrombocytes or the thrombus. We can have embolisms, right? So again, in this case, embolisms have to do with plugging up an area. This could be something solid or it could be something within circulation. Hemophilia, so our body has, or our cells have challenges with their ability to clot. And then thrombocytopenia. So this is where we just have low numbers of platelets, right? So these are different ways, again, hemostasis, the balancing of our blood, right? So these are different clotting disorders that have to do with the amount of blood clotting that happens or the lack of, or specifically the cells that have to do with the clotting. The last slide here are just a few terms that we can look at, just additional clinical terms that you might see throughout this course or if you're going into the nursing program here. So at this time, if you guys have any questions on this or any questions with Chapter 14, please let me know.